When you hear AI in healthcare, chances are you're picturing robot surgeons or something straight out of a sci-fi movie. But here's the thing. The most immediate AI revolution isn't about that at all. It's happening quietly, right in your local clinic, acting as a silent, helpful copilot for both your doctor and for you.
You know that feeling, right? You walk out of the doctor's office and it feels like you just sat through a high-level biology class. You've got a prescription, a bunch of medical terms swirling around in your head, and you're just a little confused. It's an incredibly common feeling.
Well, what if you had a personal translator for all that medical jargon? That's exactly where generative AI is stepping in. It's becoming this bridge between complex medical speak and the clear, simple information that we all need to actually take care of ourselves.
So, where does this whole AI-assisted journey even begin? It actually starts before you even walk into the clinic, at what everyone's starting to call the digital front door. Just picture it, an assistant that's there for you 24/7. So instead of typing your symptoms into a search engine and falling down that scary internet rabbit hole, you can actually talk to a chat tool that's designed to guide you.
And the way it works is designed to be super intuitive. You just start by explaining what's wrong, in your own words. From there, the AI basically acts like a triage nurse. It'll ask some follow-up questions to figure out what's going on, and it's always on the lookout for critical red flags that mean, hey, you should probably go to the ER. And based on what you say, it then points you to the right place to get care, which can save you a ton of time and worry.
But that's only one side of the coin. While you're talking to the AI up front, there's another AI working behind the scenes, this time as your doctor's copilot.
This quote, wow, it really gets to the heart of a massive problem in healthcare, physician burnout. A huge chunk of a doctor's day is spent on paperwork, often after hours, what the industry actually calls pajama time. It's totally exhausting, and it pulls them away from actually caring for patients.
And this really shows you the difference. It's night and day. The old way meant doctors were just buried in paperwork, typing up notes long after everyone went home. But with an AI copilot, that mound of admin work just shrinks. The AI can summarize conversations as they happen, draft up clinical notes automatically, and even get prescriptions ready, just waiting for the doctor to give the final okay.
So, okay, the doctor's workload is lighter, which is great for them, obviously. But what's in it for you? Well, it means the information you get after your visit is about to get a whole lot clearer and way more helpful. Just look at this. On the left, you've got the technical note the doctor would write for the chart, and on the right, the AI-powered translation written in plain, simple English. It's the exact same information, but one is confusing, and the other is crystal clear. This is an absolute game changer for understanding your own health.
And that clarity applies to everything. We're talking about post-visit summaries you don't need a medical dictionary to understand. Simple, easy-to-follow instructions for your medication. The technology can even translate discharge notes into different languages, or help you figure out the confusing bits of your insurance plan.
Now, you're probably wondering, how does the AI know what to say and keep it accurate? Well, the secret sauce is a technique called Retrieval-Augmented Generation, or RAG. This is really important because it makes sure the AI isn't just pulling answers from random websites. No, it's grounded in approved medical literature and the clinic's own specific policies, which makes the info super reliable.
Okay, this all sounds pretty incredible, but it brings us to the most important question of all, right? How do we know this is actually safe? When it's our health on the line, good enough is just not an option.
So here's the #1 rule, the most important thing to remember. The AI is only ever an assistant. It's a copilot. It can suggest things, it can draft summaries, but the final call always rests with a human doctor or nurse. They review and sign off on everything, period.
And on top of that, there are all these other safety guardrails built right in. Like I said, nothing from an AI ever gets to a patient without a human clinical review. Every single action the AI takes is logged, so there's always a digital footprint. Your personal health info is locked down tight. And there are always clear disclaimers that this is helpful information, not a substitute for real medical advice.
So when you put it all together, the big wins become pretty obvious. For patients, it can mean shorter wait times because the whole system is just more efficient. For doctors and nurses, the clerical burden goes way down. And maybe most importantly, when patients can actually understand their instructions, they're more likely to follow them, which leads to better health for everyone.
Ultimately, the real goal here is to create a new kind of partnership in healthcare. The idea is to let the AI handle the paperwork and the administrative grunt work, freeing up our amazing clinicians to focus on what they do best, the human connection of caring for you. And that kind of leaves us with a really fascinating question to think about. If your doctor can spend less time typing into a computer and more time just talking with you face to face, how might that change the very nature of that doctor-patient relationship for the better?